Dr. Madan. We'll have Dr. Ankit Agrawal speaking about refurbished equipments, and then we'll see how to go about. But nicely done.
So, morning everybody. So I'll be talking about refurbished equipments. So we all heard Dr. Madan speak very brief, in a very clear way why we should buy new. But a point which he raised, which I will raise again, do we all have so much money? See a basic setup, just a slit lamp, a chair unit, OCT machine, because now OCT is a part of basic setup, a microscope, a phaco machine, that's it, right? If you buy new, it's going to cost north of 1 CR. Do we have that much money? That's why we buy refurbished. Not necessary that we have to buy refurbished which is so old that it's outdated. There are many centers who change their machines every 5-6 years. 5 years old is not really outdated. Ophthalmology is really inexpensive affair. We cannot rely on everything new because the charges are increasing day by day, and with certain government schemes the price of treating a patient is reducing again and again. So in the beginning of our careers, when we don't have so many patients, we have to attract patients by the equipment which we have. No, we did not tell the patient these are refurbished equipments. The equipment should work. It should help us in our practice. We should be able to diagnose. That's the main point of it. Everything is connected to our finances. We have high rents. We have high overheads. A new equipment comes with various other liabilities. We might have to do IOL bundlings with them. Then we are forced to put a particular IOL for next 5-6 years of our life. We might have to invest in various compatible softwares for the new equipments. And when buying a new equipment, we might have to take loans. The interest rates, then again we have to start paying money for that. So, how we go about it? Buy refurbished, but be very strategic about it. Don't buy an equipment which is too old. See what I do? See, I bought an OCT recently, a refurbished one, but I didn't go for a time domain one because it's outdated. We know it's outdated. Go for a spectral domain OCT which is currently being serviced. That is very important. The company should be currently servicing that particular machine. That we can definitely ask the company person that will you be able to give CMC or AMC for that. That we can picture and that we can decide. We have to market these machines to our patient that we have this particular machine. See, a new say multi-spot laser might be costing something around 30-35 lakhs rupees, but in our refurbished one will cost something around 10-15 lakh rupees. So we can market. So we have a Pascal laser with us. Patients get impressed by armamentarium. Maintain a lot of machines in your OPD. Patients think, oh, you are a good doctor. There is a faster growth in revenues and volumes because if the more machines you have, the better tests you can do. You can charge them. You can get more money from them. Now, we have to decide whether a machine is refurbished is worth buying. Check the equipment properly. Spend some time with it. We are in the beginning of our career. We are not so busy that we cannot actually research an equipment. Spend some time. We all are very tech savvy. We can research on internet. We can talk to our friends who are in various institutions how they are handling these. We have to find out whether they are the current generation or are the previous generation or how old. We have to think about the pricing. Just don't go by the fact that this is 10 lakh rupees. We have to find out what was the pricing when it was originally bought. Will it be viable in today's scenario? We have to check the condition of the machine personally. I always go to the place where it is stored. I see it there, then I get it packed in front of me and then I buy it. We have to know the authenticity of the seller and the durability of the machine. Thank you.
Thank you, Dr. Ankit. That was very nicely presented. So I'll just ask both of you like one question. If you want to buy a cataract machine, okay, a machine for phaco, right? So would you, as you're saying, would you go for a newer machine or would you want to go for a refurbished one? And what would be your pros and cons? Because what Dr. Ankit was talking about is you should know about the machine, whether it is working and whether it is equipped with the latest. Because since phaco is something which everyone is doing, and we'll ask our specialist, the panelist after that. But for a basic person, when somebody is stepping out, one criteria is like there are some whether to actually go for newer machines or whether to go for refurbished, because your clinical skills are also in take. So even that comes into picture, where if you're buying a machine to do surgeries or if you're seeing an like an OCT machine, so even that is something where a person who's a retina specialist, he will be able to pick up some things. But for a general comprehensive person, it's a very different take for him. So apart, can you just give me those, then I'll come back to it.
Yeah, so besides the debate, to be very honest, what many points that he said are true. And to answer the question that's put in front of me, in fact, I have a refurbished vitrectomy machine. And why did I buy that? The single point was it was sold to me by the hospital where I was visiting. So it was just down the road, and I used to do all the retina surgeries. I was working on that particular machine for 3-4 years. And then they said, why not you take the machine itself? We'll send our cases to you. That was a good deal, win-win situation for both of us. So the crux of the whole point is I have worked with that machine. I have not gone and seen it somewhere in a conference, in a stall or something. So I have worked with that machine. I know what it's going to give me. Point number one. And point number two, I'd be a little more comfortable going for a refurbished equipment with mechanical parts rather than a refurbished equipment with electronic parts, if you get the drift.
Dr. Ankit?
Yeah. So we are in the exactly same scenario. I have a Alcon Constellation, which is a refurbished machine. So before I bought that, I talked to my Alcon engineer whether you will be giving me a CMC for that. That machine had a lot of issues, but because he was ready to give CMC, in last 1 year he has replaced almost every part of that machine, and it's working like new now. So that is what the company should be able to support you. If you get a CMC, after that you are home free, because now the CMC is there. Anything goes wrong, it is covered. That's what. I never buy a machine which is not being supported by the company. That's the one rule I follow. And microscopes are the best examples for that. See, microscopes have all mechanical, but as you said, all mechanical. Only the electronic portion is the light source. Okay. So I buy microscopes. We have 3 refurbished microscopes, and all are working very well, because example, Zeiss has a lot of ex-engineers working around, freelancing, doing repair works, and it's getting by very easily.
So I would want to ask Dr. Ashish about this now, since you're working in a one-tier place in Mumbai. So if you have a refurbished any instrument, or maybe people do go in and they do check out with what sort of instruments you have, and then only they would want to get operated at times. So what is your take on it, where you say that this is the machine which I have, and another ophthalmologist down the road has a better machine to operate? So how would you cater it, and what is your call, whether would you want to take a newer machine for that?
So see, we are in a very price sensitive market. If we see India overall, patients will not come and ask us, what microscope or vitrectomy or this you are using. They will see the basic end cost of a surgery. They see the confidence of the doctor, what percentage or guarantee they are giving as to the improvement will happen post surgery. See, when we are beginning our journey, we have option of Indian versus an MNC, buying machines of Indian companies which will cost between 30 to 50% of what MNCs are offering. And like if we take Alcon Constellation, now issue is they are giving everything in packs of 6. So we have to buy everything in packs of 6. And if we see the macro trend, what is happening all over India, with cashless everywhere being promoted, the payments will come after 2 months. You're buying everything in packs of 6. Dealers are giving 30 days payment period, so heavy cash flows are getting affected. Insurance companies are paying 20,000, 25,000 packages for the surgery. Vitrectomies are 35, 40,000. It is not practical to offer that with the MNC machines. We have to adjust ourselves on the Indian ones, and see, with AMCs and CMCs also on the Alcons and other machines goes to 3 to 5 lakh per year. So if we train ourselves on Indian machines, but yes, I feel, see, certain things like a phaco machine, that is our bread and butter, we should not compromise. But on other things, yes, we can buy other machines, like Earthly is the best selling machine. So based on demand and supply also, we see that almost 20% the prices are increasing year on year. even optical biometers. If you see, Tommy OA2000. So from Japan, even Nidec is from Japan. Nidec is at 15-16 lakh since 6-7 years. Tommy has increased to about 20% year on year. So a lot of, it's a demand and supply market. And just to stretch what you said, no, buying equipments which have more mechanical parts, yes, I agree. So auto-ref, slit lamp or a microscope will be a good buy to buy second-hand ones. I work in a group family practice with my father, and we have auto-ref which is working since 14-15 years. Microscope is a safe buy. So I recently bought one Apasami True Glow higher-end microscope from sir recently. So I'm quite happy with that. So we have to be, very price sensitive in India. Maybe we'll discuss further also. We have examples across sectors. If we see Indigo Airlines, they work on very cost effective lower pricing model where they have split, buying tickets, seat preferences or fast forward or buying meals. So they have separated that from purchase of the seat, and they have become 60% market shareholders. We'll discuss more later.
Yeah, so I would want to ask Dr. Gunjan, since she is a refractive surgeon here, so how would you go about with the idea of buying newer machines? And I would actually also want to emphasize on something where you can have group practice, where you can not have the onus of buying everything onto yourself. So if you have 2-3 people, so somebody can sponsor, and like in a group practice, there is a possibility that someone can go ahead with buying newer machines depending upon the demand of the place you're working.
So, as everybody pointed out, like if you are having a anterior segment practice, a cataract refractive practice, in cataract part, I would not like to compromise with the biometry machines, and also I would not like to compromise with the measurements that we do. So for that part, I would definitely want to buy a new machine. But then in the LASIK etc. machines, if you want to buy, they are white elephant, so you cannot buy alone. You always have to either bundle, or you have to find some group partners to start up a machine. Sometimes a good buy if you are having a refurbished LASIK machines. But yes, refractive practice, if you specifically ask, refractive is more of about branding and advertising, and also patients are aware which machines you are operating them on. So in a metropolitan city, if you are practicing, then patients are much more aware about what kind of machines you are using in the refractive. In the cataract part, they do not ask you which machines you are holding up, because they are like more of lens or IOL oriented, and insurance companies are paying for IOL. So phaco machines maybe we can compromise with, but with microscopes, refurbished, they do work better. If you're buying from the company, they give you good schemes, like Dr. Ankit also mentioned. So if those kind of things are happening, why not buy a refurbished? But few things you will have to be very careful when you are branding your place. You can always buy that kind of machine with group practices. That I feel about. Baki, Dr. Aarti can also shed a light.
So I feel it depends on your usage. So something which you are going to use for every patient, you want to buy the best one. So let's say I'm seeing 50 patients in OPD. So I don't want to have a second-hand slit lamp or NCT or auto ref, because all of my patients and their relatives are going to see that, and I'm going to use that more. So I'll try to buy that a new one. Something which I may not use that often, let's say for that matter, a perimetry. So I may do 10 perimetry or 5 perimetry in a day. So I might compromise on that. So it depends on the usage. Here we are talking about, the topic says that diagnostics and OPD tools. So yes, we can compromise on getting a second-hand microscope or refurbished microscope. But you may not want to compromise on a phaco machine, because that is going to be your bread and butter. And if in case you're stuck during the surgery, that might be a trouble for you. So it entirely depends on your usage. That's how you can prioritize which one to buy fresh and which one to buy refurbished. But both of them definitely have a role in your practice, whether you are youngster or not.
So Dr. Ipshita, your take on this, and then we'll close.
So like just like we're discussing, I feel that there is no straight either this or that. It depends on what it is, from whom you're buying, how well you know the vendor, even if it's refurbished. And at the end of the day, we buy refurbished because of the monetary factor. And if like for the instruments which we are using, for like you were telling that for all patients which are more commonly used, and we can get loans which are, you know, where we don't pay the EMI for the first year, or which have no early repayment penalties, and if we can get those deals, at least for the instruments which are most commonly used, we could choose the newer ones, and for the others, the refurbished probably.
Yes, the general consensus is what Dr. Ipshita is talking about. We should set our goals, and depending upon what the availability and how you want to invest into that particular machine and how much return that would give. Because the ROI is one thing where some machines are bought for the ROI and some machines are bought depending upon the scenario where you are placed, and where you don't look into the ROI. It's more about the marketing and getting patients to your OPDs and seeing to it that the amount of your flow becomes much easier, where the patient has more like friendly sort of an experience when they come to your hospitals. So thank you, Dr. Madan and Dr.